Okay, so my topic for this week's discussion is hiatal hernias. What are they? A hiatal hernia is when the stomach protrudes through the diaphragm into the thoracic cavity. 50% of patients with hiatal hernias are asymptomatic. However, hernias that do cause symptoms must be corrected by surgery. They will not correct themselves. All right, so just some notes on the nursing process for hiatal hernias. First assessment, like I had mentioned before, 50% are asymptomatic. Symptoms that a patient will complain of: heartburn, regurgitation, dysphagia or difficulty swallowing, dyspnea, or the sense of fullness after eating, or chest pain after eating. So some nursing diagnoses that could be pertinent to a hiatal hernia. One would be risk for aspiration related to reflux of gastric content. And another one would be acute pain related to swelling and pressure as evidenced by a pain rating on a 0 to 10 pain scale. So some goals for this patient would be the patient would be able to state the steps of preventing aspiration after 2 hours, and the patient will express feelings of comfort after being medicated. So these goals are pretty much pertaining to, pre-surgical care of these patients. Some nursing interventions for these patients. We're going to want to instruct the patients to take in small and infrequent meals. We're going to want to elevate the head of the bed for the patient to reduce pressure on the hernia site, also to prevent that reflux as well. And then we're also going to administer IV fluids and analgesics as prescribed for the patient's acute pain. Lastly, evaluating. You're going to want to evaluate, make sure that the patient had no episodes of oral regurgitation in the allotted time. We said 2 hours. And you also want to make sure that the patient has reported reduced pain as evidenced by a score of less than what they originally stated on that 0 to 10 pain scale. So overall, that is just a quick summary of nursing care for patients with hiatal hernias.